It's very important in dementia, as you know, is to try to diagnose as early as possible and try to manage the patient as early as possible. There are a lot of cultural differences sometimes and some differences between countries as well. At the same time, there are differences in the availability of diagnostic testing. Therefore, in a lot of countries in the Middle East, you have sometimes to rely on your clinical histories, on your really, not all the diagnostic tests are available. So we do rely on that a lot of time, and we try to do as good job as possible. At the same time, it's very important to take care of the family itself and to be able to really support and help the family. Symposium as well handles early diagnostic testings and the possibility of what will the future will help us. In addition, I'll be trying to focus as well on education, importance of education of primary care physicians in dementia care. If you take the MENA region, Middle East and North Africa region, the countries varies in this region. We have countries that are very rich. They have practically everything available, but they don't have possibly the personnel, the trained personnel in geriatric care and Alzheimer care. And you have countries where money is low, like Lebanon, Syria, Iraq, Egypt. Here, we may have the personnel, we may have the trained people, but we don't have the money to do all the possible diagnostic testing. So there is a lot of variation, and one of the biggest gap in the whole MENA region is lack of the healthcare professional team that can take care of the elderly. We are ill prepared in the region. Government in the region up till now are not really interested in elderly care services. They are more toward tertiary care services, toward hospital services, not real elderly care services. In addition, the number of geriatricians in the region is low, numbered by not more than 300-400 geriatricians in the whole region. So this is very low. And certain countries, there are no geriatricians. Like in Iraq, there are no geriatricians at all. In Emirates, despite all the richness, there are a couple, 4 or 5 geriatricians. Saudi Arabia, couples. The countries with the highest concentration of geriatricians is Lebanon, Tunisia, and Egypt. But still, it is relatively low. Give you the example of Lebanon. In Lebanon, we have like around 25 geriatricians for a population of 6 million. And we are an aging population. Lebanon, we are almost like 13-14% of the population above the age of 65. So there is a huge need for geriatric training in the region.